This show is dedicated to all solutions for substance use disorder. So many people struggle with substance use and mental health issues, and the landscape has changed dramatically in the last few years. Many thanks to OASIS, which is the governing body of New York State, being receptive to all families who have struggled and lost. I lost my 21-year-old son 7 years ago, which is still very surreal to say. But we need to reach our communities and give resources still for all the barriers for treatment for substance use. And today my special guest again is my good friend Stephanie Campbell. She's coming to us via Skype. And we're going to talk about the CHAMP program again and the Ombudsman program in New York State, which is the champion for insurance barriers. Many folks are still struggling and being told that they have to fail and/or we don't have the right coverage. And this new innovative program, and hopefully it is a lasting program in New York State, because unfortunately, insurance problems never seem to go away. And we'll talk about what just happened in the budget and how I think more things will end up happening now. Is Stephanie, where is my Stephanie? There she is. Hi, beauty.
Hi.
So, couple things. So really exciting. The parity law was written into effect. Thanks to a non-partisan issue, right? And the Senate and the Assembly and the Dems and the Republicans all came together. And it looks like we're going to have 28 days worth of treatment without having an insurance review, which is huge, which is so huge, to give folks really the ability to get a little footing under them, right? When you're struggling, especially with an opiate or heroin addiction, by the time your brain becomes less foggy, you still need that time that you're not worried about being told to leave and try to mitigate this disease by yourself.
Yeah.
Right?
Absolutely. Well, there's been a number of incredible things that this law is going to do, and so many thanks to the hard work of different agencies that came together.
Yes.
The governor and the commissioner, Arlene Gonzalez Sanchez, the hard work that she's done, and the team on both the Assembly and the Senate side, who worked diligently together, as well as the different agencies, DFS and OMH, who really came together to make this possible.
Yes, it's nice when everybody plays in the sandbox together. And it's great to have a commissioner that really understands substance use. And it also includes alcohol. It also includes now, unfortunately, I'm so thankful that marijuana didn't become part of the state budget this year, because we really need to look at what that's going to do to the state of New York, because the other states that have gone on to legalize marijuana are struggling with homelessness and so many other issues that are directly related to the use of marijuana, that let's just take a step back and just see how that looks here in this state before we go ahead and do it.
Agreed. I think that what's become clear is that everyone wants to just make sure that all of the evidence is collected and reviewed, and that good, sensible policy is done. So, but back to your point in terms of the 28 days, I think it's remarkable now that what this new legislation is going to do, what these provisions are going to do, is allow all SUD treatment that is in-state OASIS certified and that's in network to start and continue without insurer interference for 28 days. So that's really quite
Huge.
a remarkable.
Huge. Well, how it went from 28 days to 6 days, 3 days, 7 days was really egregious on the insurance company's part. So, you know, what needed to be really pointed out to them is, right, when you take someone out of treatment prior to really giving them some footing, not in quicksand, right, it leads back to an overdose visit to the ED or death. We don't want death to happen. So, but all of those things, which are much higher level of care and much more expensive for the insurance company to pay. You know, those first 14 days of treatment are at a much higher level, really, than the last 14 days of treatment. You're getting stabilization in there and some skills built for people struggling, you know, and building a network and a wraparound plan so that you have a discharge plan. You have to give people the ability to get that discharge plan in place, which may or may not include going home, right? Home may not be a viable option or a safe option. And we need to have all of those things worked out if we're really going to give a person a hand up and not push their face down in the mud again.
Exactly.
So, yeah. And what you're doing now, and I mean, we have some firsthand cases, just you and I, never mind the rest of the state, with the Ombudsman program and the CHAMP program. Unfortunately, sometimes, and it's been with Medicaid primarily, Medicaid putting these parameters on someone who has used services too much and putting them in touch with the hospital, not in proximity to anywhere that a patient may live, and saying you can only use this hospital for non-emergency services. And you can't get transportation there unless it's for emergency services. So everything they say is contradictory to what treatment or what health care should be. So I know that we've called you and we've gotten all of these things lifted. So tell me how that works on your end.
Well, I think what was really interesting about this specific case that you talked about, and there's been a number of cases that, you know, I can touch on a few as we continue our conversation. But I think what was really sort of illustrates the magnitude of what this program is trying to do and the potential impact and already impact that this program is having is that it allowed for us to bring, you know, all of these different conversations to the table. And so, for example, we, you know, obviously connected with the individual who needed care, and you were instrumental in, you know, making that connection between that person and myself. Then I was able to reach out to our team and get some sort of parameters in terms of, you know, what some of the issues were that we were dealing with the case. And then we were able, because of this program, we were also able to connect with the plan itself, which I'm not going to name.
Right.
But that we were able to connect with someone at the plan, you know, high up in the organization, and have a conversation, a very constructive conversation in which we were able to say, you know, to the plan, these are the issues that we're seeing. Can you help us with the process? Can you help to, you know, get us where we need to go with this person, to give them, you know, to make sure that they get the cares and the benefits, the plan that they're, you know, that's being paid into for this person to get the care that they need. And because of that multi-pronged approach to bringing, you know, folks to the table and to being able to have an ongoing connection and engagement with the person through you, and then through with me, and then through with the you know, the plan and the team, fortunately this individual was able to get the help they needed. Yeah,
but you know, so a little backdrop for people watching, this poor young man had made probably 70 calls that were documented by the plan, but it never moved forward from his point. So again, insurance company kept this barrier from him to getting the very treatment that was going to keep him alive, right? And frustrating. And it allows his disease then to talk to him and to grow again. And we never want that to happen. And no insurance company wants New York State calling them or the Department of Financial Services, because that's who governs them. So, and if the Attorney General had to get involved, then that's what's going to happen. They don't want their books open to scrutiny. So it's going to, right? So they're much more cooperative now. And they need their feet held on the fire. So there's a way to do it friendly. And then there's a way that it can be escalated for the moment in time that it is. I mean, the other such egregious case that we had was the poor gentleman in the hospital, right, who they were going to release him and nobody wanted to have a conversation with anyone. Fortunately, we had a family that was really prepared to stand their ground and didn't take him out, because he probably really, that would have been the last, he would have died. Very sick individual that we connected with all the right people. And fortunately, that's going to be a long time case study, I think, what happened to him, right, Steph?
Absolutely. But I think, back to what you said in terms of, the first case, I think that there's a conversation that's happening. I think there's been a real siloization. I don't know if that's a word that I've just created or if it's a word that exists.
You just created it, and I like it.
Okay, good. Siloization. But where you've had sort of the plans over here, and you've had the government agencies over here, and you've had the family members over here, and you've had the the folks that need help over here, and there's been all of these different conversations happening. And what's remarkable now is that there's an integration that's going on, where people, because of the advocacy work of you and others, and talking about the need that exists, and having successful relationships with government agencies that want to help, but don't haven't always known exactly what needs to be done without these critical conversations, to the plans themselves, which, are in their businesses. And of course, there's a business model that they're operating under, but these aren't necessarily, they're not necessarily the enemy, right? And they want to help people. They're in the business of helping people. And so when we can start to understand and approach with best intentions, and let folks know that we're open to finding a solution, then things really start to happen, when we can bring people to the table. Not to say that there's not, that there haven't been, and we certainly know that there was a landmark case a couple of weeks ago in which a plan that will remain nameless was found to needing to make some adjustments to the way that it's operating. And this was determined in the courts. And hopefully, moving forward, we're going to see some changes to the way that plan conducts business. But the truth of the matter is that there is a way, because of the advocacy that's happening with all of these different stakeholders that are coming to the table, in which there's a proactive, solution-oriented change that's happening, and the consequence of that change is that people's lives are being saved.
Absolutely. So and I love the way we say that, because that's what I always say to people, either peers or families. Let's not worry about what the problems are. Let's find the solutions. Let's stand in the solutions. Enough about pointing fingers back and forth. Here's the problem. Let's come to a solution for it, because ultimately, we don't need to point and blame and this and that. Those days are over. Let's just move into a new sense of cooperation, really, or collaboration, right? Insurance companies don't always, they want to do the least, right? They don't want to do the thing that costs the most money maybe right away. But that doesn't mean that they shouldn't do that thing right away, whatever that treatment may be.
Won't recognize.
Correct.
Or that they won't recognize and understand that it would be a win-win to get, the individual the care that they need initially, so that it's cost saving and life saving, in the long run.
Unfortunately, my son was told, I can't tell you how many times, he needs to fail at outpatient. How is that a solution to a problem? And those were the words that they used. You need to fail at outpatient. So we know you're going to fail, but we're going to go through this exercise and we're going to continue to let a fatal progressive disease become a fatal progressive disease.
Yeah,
so,
absolutely.
And it used to, insurance companies used to say, well, ASAM, right, says that failure at outpatient is the course of action that we get to take. Until I found the page in that 6,000-page report of, it says, never is anyone supposed to fail at outpatient. So, until people can tell you whatever they want to tell you, it's up to you whether you choose to believe it or not. And I still think that in the big scheme of things, the more difficult that things become for you or for families, the less likely you are to pursue it. Me, that's when I say, game on, let's do this now, because now you just pissed me off. So I'll do that for someone, but people get tired and they get frustrated, and when you're dealing with your family and your household and your job and someone spinning out of control with a healthcare issue, right? Life becomes very unmanageable, and that one extra thing that you may have to do may just be the thing that you are incapable of doing. So that's why I love that you're there to fight that fight, so we'll always hand the baton off and let you go to bat for them.
Well, but again, back to, the work that you're doing and Avi's doing, and so many of these, peers around the state that are really becoming engaged in the process and providing that lifeline to the person that's still suffering. And the person suffering, to the point that you just raised, also includes the family, right? Because the family, the stress that happens to a family when their loved one is threatened with potential death from an illness that's not being treated, is excruciating. And so to have that lifeline of connection and engagement and community, where the person is not shamed because of their illness, where the family is not shamed because of their illness, that it's okay to ask for help, that it's safe to ask for help. That you're going to, when you ask for help, have someone there who is going to be able to guide you and be that, that presence, so that you're not alone, spiraling into that despair and that terror, is so much a part of, the power and promise that recovery brings when folks are engaged. And even if they don't get it the first time, right?
Yes.
Because we also talk about, there's been historically a frustration, or, to the case that we started talking about with this individual who had multiple attempts at, certain forms of treatment, and yet didn't necessarily get it that time, but was engaged. If we can continue that engagement, provide them like we would any other illness. If someone had diabetes and they had too much sugar and their insulin shot up and they had to be taken to the hospital to be treated for their diabetes, we wouldn't shame them. We wouldn't blame them. We wouldn't shame the family.
Yes.
How could you have let them have that jelly donut again?
Exactly. But
if we start to draw those comparisons between, our chronic illness, the illness of addiction and mental health issues, and other chronic illnesses that as a society we've we've treated with much more dignity and respect for the person. And that, of course, brings in the issue of parity that we're really now starting to um, that's that's building a real national conversation in terms of we need to treat mental health and addiction issues on par in parity with medical and surgical
Yes.
issues,
Yes.
right?
You know, it's incredible. There's only one commercial that I do appreciate now with anxiety. And I don't know if you've seen it when the girl is driving and she's having a anxiety attack and all of these things jump on her and she gets home and everything is falling off of her, and it took everything for her to get home. Just to get home. People don't realize, you know, when you have substance use or mental health issues, they're diseases of the brain. They are not easily rectified because,
Exactly.
you know, even when you have a conversation, it's my perception of the truth, it's your perception of the truth, and then there's the actual truth, right? So it's how my brain comprehends the circumstances at the moment in time that it is, right? And people that struggle with things that are going on, how can we expect them always to make good choices when their brain actually is compromised? If their liver was compromised, if their heart was compromised and they couldn't run a mile because they had cardiac disease, well, you'd say, well, of course they can't run a mile. But just sometimes the activities of daily living, right, become issues. Going to work, having a home, you know, just washing yourself sometimes for folks is a difficult job for them to do, a difficult task because of the way that everything has made them feel. So, you know, we need to remember that just as humans, someone is always going through something, right? And you don't know what they're going through. So just because somebody cut you off doesn't mean that they're, you know, you can't curse at them and flip them the bird. They may be rushing home because they haven't, right? Who knows what goes on in people's worlds anymore?
Yeah.
Because the stress of making it, right, and providing and all of those things is pretty overwhelming, especially in the state of New York. I know that for us. So to throw in that I pay my premiums, I have coverage, and yet I can't get treatment is ridiculous to put on a family that is struggling and suffering. You know?
Yeah, I mean, I think to your point, the magnitude of what people are managing
Yes.
in their daily lives, to compound that with the stress of someone who is, actively engaged in an illness that is, oftentimes prohibiting them from working or working up to their potential, and that's having an impact on their health and wellness, and impacting their ability to have relationships that are connected and supportive, and where all of their major life areas are being impacted by this illness. And this family is trying to keep the family, the family members are trying to keep the family going, while at the same time trying to get their loved one the help that they need so that they can get better. The stress that creates. I mean, I've had conversations with family members initially where they're just enraged and they're frantic.
Yes.
And what I'm finding, and what I have found in the work that I've done previously, as well as the work that I've done now, oftentimes people just need to be heard. They need to know. And I think I've talked with you about this, and certainly, my incredible mentor and boss, Rob Kent, talks about this too. That we have to engage in radical listening. That
Yes.
that ability to just sit and listen to someone and let them know that they're being heard is so much a part of the engagement and the initial healing process, because so many people have had, doors shut on them, and they've been, ignored, or, pushed aside, or denied, or, they've had just barrier after barrier after barrier put in front of them. And by the time we often get to them, they're at the end of their rope, so to speak.
They're at the end of their, and I sat with a mom yesterday, but just for me to be able to say, I understand. I've walked a similar path to you. I don't know how you feel, but listen, when I can say to her and she goes, exactly, that's what I'm going through. I understand. So you know what? Let's just give you a little bit different language to go home with. Let's just start your road to recovery and watch how quickly your household begins to change. And that's the magic of recovery. Because everyone, the family, unfortunately, goes on the roller coaster ride whether they wanted to or not. They're in the same crisis as their loved one. And you can't base your life on whether the person struggling is having a good day, a bad day, is, walking a road of, abstinence, or walking whatever their road may be. You can't be attached to their road. You need to be attached to your life.
Well, and I think that part of the healing process for the families, right? And I had this experience in my own life, being a person in recovery, which, I've been very out in the process of coming out about my recovery and getting comfortable speaking about it, and reversing some of the stigma that exists around recovery. I thought, oh, good, I've got this down. I'm in recovery. And then one of my daughters became very sick. And having to learn how to allow her process of recovery, having to allow her the space to get better. And that my job as her mother was to make sure that I was taking care of my own recovery, doing what I needed to do to support my health and wellness. And then, showing up for her was much better, not only for her, but for me as well, so that I wasn't frantic. But I think that the recovery journey is an incredible journey for not just the person who's engaging in that recovery process, but for the family as well. For the family, because unfortunately everybody gets to play, and it leaves collateral damage always. Stephanie, we're going to be right back after this message. Okay, I'll see you in a few minutes. We'll be right back. Stay tuned.
One, two, three. Long before my dream of playing professional football became real, addiction impacted my family and nearly destroyed it. As a New Yorker, I can tell you that all our communities are being hurt by addiction. New York State is leading the fight in combating addiction, providing help and treatment regardless of your ability to pay. For more information, visit combataddiction.ny.gov. Growing up as a young kid when addiction was around was tough. It was, at the time, I felt like it was unfair. I had to grow up quick. At the age of 11, my father left the house after, a couple months after I found drug paraphernalia in their nightstand. And it was a tough reality to face as a young kid. And, there were good days and bad days, but there were a lot of bad ones. After my father left, we got kicked out of homes. There were people in and out of my house, and I didn't understand, why did this happen to me? Why did addiction have to be, why did my parents have to be addicted to drugs? Yeah, going through recovery it was a long road. You know, when I was a senior in high school, my mother went away to prison. You know, I had to go through my college recruiting by myself. I had to go off to college. You know, my friends' parents took me to college. And so it was tough going through those times. But when my mom decided that she wanted to change her life, she wanted to get help. You know, my mom got sober in prison. She got out of prison and gave up drugs and regained her relationship with God. My mother works for the church now, and we have a great relationship. I tell her every time I talk to her how proud I am of her and what she's accomplished. You know, she's a tough woman. She's been through a lot, but the things that she's done after prison have been amazing. You know, I'm so proud of her. She got her associate's degree. We have a great relationship. She's a great grandmother to my nieces and nephews, to my children. She's always there for me when I need to talk to her, and we have a great relationship. For a while, it looked like, you know, when you're in it, when you were in the addiction part of it, I never thought my mom would be the same. But there is a light at the end of the tunnel. You can change your life, you can get help, and you can have a better life and regain those relationships and have a positive effect on those people around you. You know, I look at, you know, when I go through tough times in my life, I ask myself, what would my mom do? Because my mom has been through, you know, I always say my mom has been to hell and back, and she's doing great, and I'm thankful for it, and I'm proud of her. My father as well. You know, I didn't have the best relationship with my father. When he left the house when I was 11, he left us with no car. I didn't speak to him for 3 years, and that was probably the toughest time of my life. But we gained that relationship back. My father's been clean for 3 years. His health is doing better. He's trying to be a better grandfather, trying to be a better father. And, you know, I forgive him. And our relationship is, you know, we're back communicating, and I love it, you know. I tell him I'm proud of him as well, because it's a tough circumstance. You know, it's easy to look at someone who's in addiction and blame them, and blame them for the choices they make. But it's the drugs, it's the alcohol that have a hold of them. And it's not, they don't want to be in that position. You have to understand that. They don't want to be making these decisions. They don't want to put these people in jeopardy. They want to get help. But once they decide to get help and to do something about it, there's great things that can happen at the end. Yeah, recovery is possible, and it happens to a lot of people. You know, you'd be surprised at how many people are in recovery right now that went out and got help. People out there that want to help you if you're in recovery. You know, there are people all over who you have no idea went through, they've been affected by it. You know, whether it's a family member, a friend, themselves personally, if they went through addiction. There are a lot of people that are going through issues that you've been through. So don't be afraid to ask for help. There are a lot of resources out there that can help you and get you the right treatment and to get you back on the road to recovery.
Welcome back, beauty. So, you know, I love that commercial now. You know, when I first did the commercials, it was Combat Heroin. And I'm so glad that it's been changed, because substance use comes in so many different forms. The substance is so unimportant to the disease, because it's not being, when using a substance takes over your life, as opposed to, I mean, that's the simplest form that I can put that in. But that also becomes eating disorders, right? Gambling. Anything that you do that overwhelms your life is an addiction.
At Friends of Recovery, we refer to it as the addiction du jour, right?
Yes.
That whatever it is that is creating that compulsive you know, way of relating to the world,
Yes.
and that obsessiveness, that's part of part of that illness, and the amazing thing is that we're starting to really understand addiction, and in the recovery community, we've been talking for years about changing seats on the Titanic, right? So that
Yes.
we'll put one drug down or we'll pick up another drug, and then for a time, and I think still in the recovery community, there's almost a kind of tier system of addiction. Like if I'm an alcoholic, I'm not as bad as
As
the
a,
people
as
that
a right, as an
right?
IV
As if.
heroin drug user, right?
Right, and the interesting thing is what we're understanding is that we're really recognizing the fact that addiction is addiction, whether it's in liquid form, it's in powder form, it's in gambling form, it's in eating disorder form.
Exactly. And to your point, saying that, and the frustration really watching parents deal with, teenagers or younger than that, right? Because now 10, 11, 12. Alcohol is a powerful drug. It may be legal, but it is a drug nonetheless. Cigarettes, marijuana, these are, well, my kid's not so bad, they only smoke pot and drink beer. No, that's not what you should say ever, right? Because all roads can lead to overuse. Not all people will be stricken with the disease, but all roads lead to overuse. And certainly in an adolescent brain, once you change the course of development, you've changed the course of development. So we need to, just don't vilify or put something on somebody that it's not so bad because my kid's only drinking, right?
Well, we lost 72,000 people last year from overdose related to opioids. We lost 88,000 people from alcohol and alcohol-related issues. So, it really is. The drug doesn't. The drug
doesn't matter. It just doesn't matter. And cocaine is going to come back around, and crystal meth is going to come back around, and all of those things that were 20 years ago are all still in effect today. But it's just not getting the news coverage.
Well, the reason I think that we got the news coverage that we have in terms of opioids is because of the fentanyl and because of the swiftness with which people can die. And I think that's what we're trying to do in terms of addressing it quickly and effectively and with good policy and understanding that we've got to get people the care that they need when they need it, because addiction is addiction. However, there are forms of addiction that are potentially more lethal quickly in terms of what is in it.
When we see fentanyl being put in cocaine and in marijuana, so don't ever think you're safe.
Yeah.
And it's funny, your drug dealer is not your friend. He's not worried about your health and wellness, worried about, creating the need. So we talk about when there is a fentanyl overdose, unfortunately, people struggling with substance use will be like, oh my God, that must have been a great high. And we're going to seek that out, which in and of itself should tell you how sick people are in the moment of their disease, right?
Mm-hmm. How powerful the substance is.
Yes, absolutely. Absolutely. So let's talk about tomorrow. This beautiful woman is going to be on Long Island, and she is going to be, where is the event, Stephanie? We have two different times.
Yes. So the event is going to be at the Yes Community Counseling Center at 152 Center Lane in Levittown, New York. Now, I'm really excited because I have never been to Levittown. I've heard about Levittown, but I'm really excited that I'm going to get to go
Don't
to
get too
Levittown.
excited.
But it's going to be an Oasis Town Hall meeting. And I'm going to be joined by my colleague, Lynn Goldberg, who's just such a wonderful human being and an expert. She's the project specialist for CHAMP. She works for the New York State Council for Community Behavioral Healthcare. So she and I have been doing a tour de force across the state. We show up at all kinds of venues, and so we're really excited to be joining our friends at the Yes Community Counseling Center, as well as the Nassau Alliance for Addiction Services and our dear friends, FIST,
Yes.
Families in Support of Treatment. And Anthony Rizzuto, as everyone probably knows, is a hero of mine and has really just done such incredible work with with the families on Long Island. So we're so excited to be
Yes.
joining you all there. We're going to be talking about insurance coverage for substance use treatment that can oftentimes, as we've been discussing, limit access duration. So as the New York State Ombudsman Project Director, I'll be joining Lynn to provide information on the Ombudsman program. And we were able to also get continuing education credits for CASAC, for social work, for CARC, and for SERPA will be provided.
Excellent.
So the two different time periods, we had hoped that we would be able to make time available for providers in the field who are going to benefit, because of course the CHAMP program helps not only folks on the consumer end, but also on the provider end to get folks access to their insurance benefits, and also to the families and to individuals in recovery and or seeking recovery who might be interested in learning more about what CHAMP can do to help them access substance use and mental health services.
Excellent. And then the evening, it will be for the general public.
Yes. So the two time periods are, and it's April 3rd.
Yes, so it's tomorrow.
Yes, it is. 2 p.m. to 4 p.m. is the first session. And of course, anyone is welcome to attend, but the sense is that we're going to have a lot more providers probably at the 2 to 4 time slot. And then the evening session is from 6:30 to 8. Again, open to both providers and consumers, family members. But my sense is that we're probably going to see a lot, the community in terms of families and individuals who might need access to substance use and mental health services attend that one.
And just so everybody knows, in New York State, there are 12 addiction treatment centers that are run by Oasis. It doesn't matter what your insurance coverage or not having insurance, you are entitled to treatment in New York State, whether you have insurance or not, and you will receive treatment in New York State. So that being said, but all the other Oasis licensed facilities must also provide treatment for you.
Mm-hmm. Absolutely.
So,
anytime, anywhere in the state of New York, there are treatment options available. And so, we recently, there's a campaign out called Know the Facts.
Yes.
In which, we're really trying to get the word out that, treatment is available here in New York State. While good quality treatment is available here in New York State, regardless of your insurance status, and we will get you
Get you connected.
treatment.
Yes.
Yeah, absolutely.
Get you connected. You don't have to leave the state. So,
No.
in the last few days, quite a few people from Florida have been arrested for, again, brokering. So we need to make folks, when someone tells you, oh, I'm going to fly your loved one out of state, exhaust your insurance coverage, have you end up with a bill that is astronomical because they are not your friends. They are, and that being said, there's really good treatment in Florida. There's really good treatment in other states. I'm not saying that you shouldn't look into that treatment, but you need to know the facts.
Exactly. The problem is we can't regulate that. We don't regulate that. So we can't say to someone, we're going to, go to such and such a place in Florida or Pennsylvania or, Arizona. And, you and I know firsthand what can happen when people who are desperate for help, reach out to someone that they think is going to get them that help. And then they're sent to a state, across the country in which they're promised, someone who will meet them at the airport and get them into treatment, only to find out that they show up at that airport and no one's there, and they wind, unsupervised, uncared for. They wind up in a place that leaves them worse off than they were before they sought help. So, there is some real accountability now that's being built into the law. Not just here in New York State, although here in New York State, there's been some incredible work that's being done. And by the way, interestingly enough, that's a case in which the insurance companies worked and collaborated with government agencies to address something egregious that was happening to individuals with substance use disorder who were being exploited by these predatory brokers sent out, and the insurance companies were, having to pay exorbitant, sums of money for bad treatment.
What's crazy is that in New York State, let's just say that 30 days or 28 days is going to cost about $15,000. And the insurance company kept saying no to that. However, when someone tapped their out-of-network benefit, right, and they paid $200,000 for the same 28 days. So the insurance company, let's call it what it is. They didn't necessarily do it for the health and well-being of their members. They did it because they were paying, they could have paid nearly the treatment for 30 people that they were spending on one. So, it is, in everyone's best interest to put your asset to the best work that it can be to help many, as opposed, the other thing that we always need to keep in mind is substance use is a family disease. So if you leave your proximity, which doesn't mean that you can't go upstate, but you need to be able to participate in your loved one's recovery. You have your own work to do also. And I know that really St. Joseph's up in Saranac Lake, which really is, you're going to have to go for a few days because it's from Long Island, 5.5 hours. But they run a 3-day family program, which really encompasses what's the beginning of some really tough work and some really reunification of this family. Outreach over here in Brentwood, right, is an adolescent treatment program. However, for the 9 months that an adolescent is in treatment, and let's talk about that from 12 to 19, because that's who they're servicing, family absolutely needs to be involved there. Siblings, parents working with a teenager. You want to be hands-on in that circumstance. Everybody needs to learn new coping skills, new living skills. How are we going to interact with one another? How do we have accountability? How do we do all of that? And these are skills that need to be taught to people. It's, you know, it's nothing to be ashamed of. Nobody, you know, you get handed this baby and you're like, wow, now what do I do, right? Now what do I do? Because nobody tells you about the rest of the stuff. We're not given a book on how to do this right. Certainly.
No handbook.
No handbook. And if you were handed a teenager, nobody would have more than one child. So, right, it's a good thing. My mother used to say that, and I'm one of 5. It's a good thing you all started out cute.
Right.
Because there wouldn't have been a next one. So, you know, but there's no handbook to any of this. And unfortunately, these predators that we're talking about are paid up to $5,000 per body to put them in a bed someplace. That's never okay. We're taking advantage of the sick and suffering.
Yeah. Colleagues of mine, T. Allen and my mentor, Rob Kent, often talk when we present. They often they have a picture of an airplane, and the caption is, "A free plane ride is never a good idea."
Exactly.
You know?
It's never a good idea.
We know in economics there's no free lunch. You know, like so. You know, so the body counts that you're talking about have unfortunately, you know, been in part a result of some of this predatory brokering. That's now
they're not making it back to their families. They're, you know, they're streeted with they're not in their neighborhoods. They have no way to get back home because they get a free ride there. They're not getting a free ride back. And unfortunately, death has been the consequence for too many people.
I got a call just a few days ago about a young man that you and I worked on who had been stranded out in Arizona as a result of, you know, someone promising him treatment out in Arizona, and he. You know, he was stranded out there. He was able to get back get back to New York. You were instrumental in getting him. You know, you and your daughter and the team that you have at Thomas's Hope was instrumental in getting him. You know, we were able to work together to get him into treatment. I got a beautiful message from him a few days ago, and it took a couple of attempts for him. He thanked me, you know, and I know, I'm sure he's thanked you. And, you know, these stories, and we have so many of these stories.
We talk every day. He's my buddy. So, you know, he's staying in touch and he's staying connected. And it's such a struggle for folks, you know, in early recovery to really stay on that path. Because the other path seemingly is so much easier to be high, to be not present in your life, you know. And I always equate it to when Thomas passed, being such overwhelming grief, you know. And unfortunately now we've seen suicides of parents from Sandy Hook victims and Parkland shooting victims. That grief of losing your loved one. Trust me, every parent, you know, why do I have to get up today? Well, you know, other people depend on me, and I always have to remember that life is still good and life is meant to be lived, and I have to stand for something too. So Thomas and I have had our journey, but going back to, if I had become an alcoholic, if I had become addicted to Xanax or sleeping pills or any of the number of things that good-meaning people said, oh, go get some sleeping pills, you're not sleeping. You know, why don't you take some Xanax? Why? If I had listened to that advice, I don't know where I would be, but I knew intuitively, I don't have to face all my grief all at once. I just simply have to be present with myself, because whenever I wake up from whatever induced state of not being conscious to the facts, I would still have to face the death of my son, always. So for anyone, you know, and whatever the problems that seem insurmountable to you, they are insurmountable to you, and no one is to judge. Well, that's not so bad. You know what I had to live through? No, 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 no. It's insurmountable to that individual, and we need to help them cope through it as best we can, and hold their hand, right?
Well, you were instrumental in helping me get through my daughter's illness. So, you know, and I've said that to you and other parents who, you know, paid the ultimate price, you know, as a result of, you know, some of the issues that we've been talking about. And so thank you for the work that you're doing, because it is that, you know, it's the lived experience that's helping change. It's been the game changer, right?
You know,
and you and I have talked about
yes,
that moment.
Because I say to families all the time, I wish I had me or someone like me when I went through it, because it's really nice to have someone say, just hold my hand, we're going to get through it. I will think of the solution for you, because right now you just need to rest in the crisis that you are, because you can't think. You can't think of all the things. You know, it's overwhelming to try to get through life when you're just worried that your daughter, that your son, that your husband, your wife, your whoever it may be, are they going to live the next hour?
Mm-hmm. Mm-hmm.
You know?
Yeah, absolutely. Absolutely.
So,
And,
go ahead.
mm-hmm. No, I think that's part of what has been, you know, such a powerful motivator. You know, we talk about in the recovery communities that our stories have power.
Yes.
You know, and that you know, the changes that are happening, and now, by the way, the new insurance regs in terms of on the Medicaid side, and we're working to get that on the commercial side as well. But the plans have to cover peer services, because, you know, the peers are engaging people in ways in which they have never been engaged before. And, you know, the hope, you know, of, you know, if Linda could do it,
Yes.
if Linda, you know, who has struggled and paid the price that she paid, is able to get up and hold my hand and walk me through this, you know, then you know, then I can, you know, maybe I can get through this. You know, if Stephanie, who, you know, went from being a homeless street kid who's now, you know, running you know, a state, you know, program to help people get access to care, was able to get into recovery and build and sustain her recovery with the support of her community, and is doing the work that she's doing, maybe I can get into recovery too, you know. And you and I are one of millions of
people
who have been, you know, given the opportunity to get into recovery and to help others, you know, to be of service. So that's, you know, that's part of the miraculous journey. And then I got to meet you, and that, you know, we've been on this journey together in the way that we've been, and just how you continue to, you know, to teach me and share with me and support and love me.
You know, and seeing Senator John Flanagan too, you know, and that's a man in recovery now, and seeing him. And, you know, fortunately, I got to speak with him last week, and I said, don't think that this part of your journey isn't meant to be part of your journey, because now you truly understand the plight of people struggling, and you can be that voice in government, because, you know, you've been forthcoming with your recovery, right? You're not anonymous. And I thank him for that all the time, because it's these important people that we see. Dr. Charles Morgan, who was the director, right, of OASIS, the medical director of OASIS, who, by the way, just joined the board of directors that I'm so proud to be on for St. Joseph's. And so great that here is a gay man who happens to be a doctor, who is the medical director that's in recovery. You know, phenomenal. Stephanie Campbell, yes, a homeless street kid with her MSW, who is a professor at NYU, who is, has worked for government, for the New York State Senate, who now is running this program at Oasis, is a strong woman in recovery. Yes, it can happen, and it does happen every single day. And you have to allow the process. And the process, one time when I was really, after going through what I went through when my kids were younger, and a therapist once said to me, when you're baking a cake, do you open the oven consistently and look to see if it's done? And I said, no, the cake's going to fall. She said, so, there's X number of years of you and your kids. Stop opening the effing oven door to see if they're done. They're going to come through it when they're going to come through it. So, I was like, holy crap. Well, that was a kick in the head, The light goes on at different times, right?
Yeah,
so we're coming to the end. Tomorrow, Yes Community Center in Levittown, Stephanie Campbell and crew. Thank you. I love you.
Thank you.
Thank you for all
you.
you do. Safe travels today. And we'll see you next week. Have a great week, everybody.